Functional Physio presents ePoster 2020. Associated by Mind Academy and Sportson.
Presenter Syed Rahila Rehman. On title: Misconceptions between Dementia and Alzheimer's.
Hello everyone, my name is Rahila Rehman. I am third year physiotherapy student from Deccan College of Physiotherapy, Hyderabad. I am here to talk about dementia and Alzheimer's, specifically to clear the misconceptions between dementia and Alzheimer's. The reason I have selected this topic is because most of the people assume that dementia and Alzheimer's are same because the major symptom that appears in both the diseases is memory loss. So let me clear you some misconceptions between dementia and Alzheimer's. What is dementia? Dementia is an acquired global impairment of intellect, memory, and personality, but without impairment of consciousness. That is, the person is aware of his environment and surroundings. There will be damage to brain cells which affect the ability of these brain cells to communicate, and this can affect the person's feelings, behavior, and way of thinking. Dementia can be described as an umbrella term used to describe the symptoms of hundreds of conditions that impair memory, behavior, and thinking. Some of the conditions that cause dementia are present in the picture presented in my poster. Do you know there are about 50 million people living with dementia, and one new case is diagnosed every 45 seconds. Dementia can be of two kinds: treatable reversible dementia and untreatable irreversible dementia. People with treatable and reversible dementia can regain their memory and get back to their normal life. And some of the causes for treatable reversible dementia are vascular multi-intract dementia, infections such as meningitis, encephalitis, AIDS, tumor that can be primary or metastatic, trauma that causes subdural hematoma. In people with untreatable and irreversible dementia, there will be permanent loss or decrease of some functions. And causes for untreatable dementia can be Alzheimer's, Huntington's disease, Parkinsonism, and degenerating diseases of central nervous system. Coming to Alzheimer's. Alzheimer's is a neurodegenerative disease. There will be loss of neurons in cortex. The most common causes of dementia is formation of plaques and tangles in central nervous system. Amyloid beta is a protein which clumps and forms plaques in the brain between the neurons. The tau proteins are responsible for the formation of tangles. Coming to the treatment part, there is no treatment for Alzheimer's, and one of the important points to note is it is a progressive disease. That is, it gets worsened with time. By using the medication, we can slower the progression of the disease but cannot cure it. So, let me show some of the differences between dementia and Alzheimer's. Dementia is a brain-related disorder caused by disease and other conditions. Alzheimer's is a disease, a type of dementia, but the most common type. Dementia is a term applied to a group of symptoms that negatively impact memory. That means forgetting the life events or taking time to remember things. Alzheimer's disease is a progressive brain disease that slowly causes impairment in memory and cognition. Dementias can be potentially reversible. Some kinds of dementias can be reversed and managed, such as those caused by drugs or alcohol and metabolic disorders. Alzheimer's disease is irreversible. There are no drugs that we can cure Alzheimer's. We can only improve the symptoms or slow the progression of the disease. See, there is a diagrammatic comparison between normal healthy brain and Alzheimer's brain given below the table. Can you notice the difference? The normal healthy brain is large, whereas Alzheimer's brain is appearing small. Do you know why? Because in Alzheimer's brain, some of the neurons are dead. Death of the neurons cause brain to shrink, narrower gyri, sulci gets wider, ventricles get larger. And that is why Alzheimer's brain appears to be small. Coming to the important part of my presentation, role of physical therapist. Physical therapists help delay the progression of the disease and help lower the issues surrounding Alzheimer's. In addition to the suffering from Alzheimer's, patient may experience problems such as arthritis, balance problems, plus loss of muscle strength. Regular physiotherapy helps to keep bones and muscles strong as coordination declines. Problems with balance and gait can often be lessened by regular physiotherapy sessions, thereby reducing the risk of fractures and other injuries. The physical therapist will work with your loved one to build muscle memory to help with preventing falls. Therefore, physiotherapist plays an important role in management of dementia and Alzheimer's patient. Coming to dementia and caregiver support group. In other countries, there are caregivers who look after some kind of challenged people. Whereas in India, almost all persons with dementia live at home and are cared for by family members. The caregivers could be the children, siblings, spouse, or even distant relatives. Most family caregivers have no idea what they need to do. Therefore, there are caregiver manuals to help such family caregivers. Many caregivers do not understand the difficulties faced by someone with dementia. They may think the person is stubborn and hurtful. The person with dementia senses the caregiver's mood and gets even more upset. Often people with dementia cannot be left alone because they may harm themselves because they'll be depressed already. They need help for many tasks. You may have to make sure someone remains with the person every time. This could mean using of attendants either full-time or for hours when you go out, or using a daycare service. You may need to switch to a flexi-time job or work from home program too. It is heartbreaking to watch someone lose memories and abilities to do things. How can we reduce the severity? Is there any way? Well, the researchers say that involvement of cognitive activities is linked to slower rate of cognitive decline, especially with episodic memory. The involvement of cognitive activities help in delaying the presentation of dementia. The interventions that enhance life experiences and activities might reduce the risk of developing dementia. German and French researchers have found that caffeine and coffee consumption help in slowing memory decline. An important point to be noted is dementia and Alzheimer's are not part of normal aging. People develop forgetfulness with normal aging, and whereas dementia and Alzheimer's are real diseases where there is memory loss which might not come back again in most of the cases. So finally, let me explain you all how the patient with dementia feel, because most of the doctors always see disease from their view and forget to observe it from the patient's side of view. For a patient, it is far more than simply a memory loss. They have problems with balance, with numbers, with directions too. For a patient, it's like struggling to live in a fog, and every time is confusing to them and finally end up with extreme tiredness. For patients, there is a stream of ideas coming through their brains, yet they do not remain there unless they speak out or write them down immediately. They are lost forever. Nobody knows except the person and his poor damaged brain how bad it is, because it is a struggle every day. Therefore, it is important to know how the patient feels so that we can help and support them in the journey of their decline. A take-on message. The best medicine to treat Alzheimer's is the love, affection, and care of those who are very close to our heart. So please do not isolate them from families and society. I hope no one has to face such diseases alone. Thank you.